Now we have another great panel for you amongst a few members of our state working group. This session will include a discussion between members of our state working group and Columbia Law School's Science, Health and Information Clinic on the importance of having a state strategy alongside federal work. I want to introduce you first to Quinn, our state working group co-lead, and she'll be facilitating the discussion today. Please take it away, Quinn.
All right. Hi, I'm Quinn Nichols. I am the state working group co-leader. And a little bit about me. I've been a type 1 diabetic for, it'll be 20 years in December. I live in Michigan in the USA, right in the middle of the state. And I have been working with T1I since 2019. I am good with any pronouns. I'm also a library science student. So T1 International and advocates are pushing for change in the United States at both the state and federal level. And in today's session, we're going to discuss why it's so important to have state level action happening at the same time as change is being pushed at the federal level. Before we dive in, I want to highlight just how much incredible work has been done to increase access and affordability of insulin in the states across the US because of advocates like all of you here today. So since 2018, Insulin for All advocates have been fighting for stronger insulin access through key legislation like Kevin's Law and Alex's Law, and have made public production of insulin one of T1I's key campaign priorities. So I'm going to give you a quick, very brief rundown of those 4 campaign priorities we have. So Kevin's Law allows pharmacists to provide emergency refills of insulin and is named after a type 1 diabetic named Kevin Houdshell from Ohio who died rationing insulin because he couldn't get in contact with his doctor's office over the New Year's holiday. Kevin's family and other advocates have gotten emergency prescription refill laws passed in 40 states, and that would have prevented his death. Alex's Law is named after Alex Smith. He was a man from Minnesota who was diagnosed with type 1 at age 24. At age 26, he aged off of his parents' insurance, and buying supplies took up 65% of his monthly income. He rationed insulin between paychecks and died 3 days before his next paycheck. Alex's Law, a law that makes sure nobody goes without insulin because of price, was fought for in Minnesota by his mother, Nicole Smith Holt, her family, and other Minnesota Insulin for All chapter members and the chapter. 4 states have passed this legislation, and 5 states are currently working on this. And public production of insulin is another campaign priority, and its goal is to increase competition in the insulin market outside of the big 3 manufacturers, Eli Lilly, Novo Nordisk, and Sanofi, who dominate 90% of the insulin market. And that would lower costs to patients, and we are supporting states in increasing the role of the public sector in the pharmaceutical supply chain, including the manufacturing and distribution of insulin. Several states are exploring and committing to the public production options. The most highly publicized one is California, and a few other states are working on it and looking into it. I'm thrilled to welcome Chris and Kaila, who are here to talk more about the work that they've been doing to support T1I and public pharma efforts, particularly in California.
Hello, everyone. Thank you so much for including us. It's really an honor to be here. Kaila and I together are a law student and an attorney at Columbia Law School. We work together to represent T1 International pro bono. Both of us are part of a clinic at Columbia Law called the Science, Health and Information Clinic, which provides pro bono legal help to T1I and other patient and activist groups. Kaila and I and my colleagues in the clinic have worked for T1 International in multiple capacities, but a main focus of our work has been supporting T1I's advocacy for public pharma at the state law, state government level, as Quinn said. Kaila is going to say more in just a second about what public pharma is, but in brief, we mean state actors, so state government agencies, taking on or complementing roles that private companies usually play. The manufacture, the distribution, the pricing of prescription drugs, including insulin. And my clinic, Kaila and I have supported T1I by analyzing existing and proposed state legislation and by informing T1I's legislative advocacy in states including California, Maine, and Michigan. Kaila, can I ask you to introduce yourself and explain a little bit more about what public pharma is?
Yes, thank you so much, Chris. So Hi, everyone. My name is Kaila, and let's just jump right into it. So, what is public pharma? Public pharma is more of a catch-all umbrella term for what we've broken
Yes,
up
public pharma es como un término paraguas muy amplio.
to three distinct categories. So, there's public production, public procurement, and public PBMs. So, what is public production? Public production is where publicly owned, publicly accountable agencies manufacture drugs on a nonprofit basis. So we've seen California with their CalRx initiative. That's the big one right now. Public procurement, again, publicly owned, publicly accountable agencies that purchase and distribute drugs. Now, distribution is not always necessary in order to fall under the public procurement model, because states have the option to purchase these drugs even if they need a little extra help due to lack of infrastructure to distribute them. A good example of this would be Minnesota's multi-state contracting alliance for pharmacy. Now, finally, public PBMs. What is a PBM? A PBM is a pharmacy benefit manager. So in this scenario, a publicly owned, publicly accountable agency would negotiate the prices that its constituents pay for drugs. So they would use their sort of purchasing power to come together and negotiate a price with the big pharma companies that's lower than market rate. A good example of this would be the ArrayRx initiative, where Washington, Oregon, Nevada, and Connecticut are pulling together their purchasing power to negotiate for lower prices of these drugs. Now, you may be asking, why is the state level advocacy for public pharma important given that federal efforts are already happening? And I'll turn it over to Chris to begin answering that question.
Thanks, Kaila. So I'll give three reasons. I think there may be more, but three reasons why I am excited to do state level work with T1I alongside the organization's federal work. The first is we see ripe opportunities at the state level to make patients' lives better and to do it in the near term. Federal work, as I think a lot of us in the US know, is challenging and slow. Our Congress is divided. In fact, our government looks like it's about to shut down. State work is not necessarily easy, but we see different and promising opportunities at the state level. There is some lower hanging fruit there. Some states seem ready to move quickly to make lives better for people living with diabetes. And we can build a network of knowledge sharing and advocacy to push those states in the right direction. California's state level insulin manufacturing initiative is already underway, as Kaila mentioned, and Quinn. And we can take lessons from California and apply those to other states. That's one reason. A second reason is that state interventions can go even further for patients than federal. T1 International's federal priorities are incredible. For example, a $20 per vial price cap on insulin. But action at the state level here in the US could conceivably do even more for patients. For example, the Public Pharma Project that Kaila and I have worked on could get insulin prices below $20 a vial. T1I has advocated, and California is now trying to implement, completely nonprofit insulin production. And under that model, insulin could be distributed to all patients at cost, or even potentially for free. And if public pharma works at the state level, it might inspire new federal law and policy. States are supposed to be laboratories of democracy, after all. So we can imagine states leading on interesting initiatives and then pushing the federal government to do more. A third reason to do state level work is that state work has the potential to create a layer of protection, a backup plan or safety net or insurance policy should federal initiatives fail or be overturned. We've seen, sadly in the US, in cases such as Dobbs, that even long-standing federal programs and federal rights can be overturned at the drop of the hat, depending on who controls the Supreme Court, other institutions of the federal government. If states had the infrastructure and systems in place to lower insulin costs through public pharma, whether that's through state government PBMs, state government procurement, or state government production, these state public pharma initiatives can create a safety net for patients, even if we face setbacks at the federal level. And I'll pass the mic back to Kaila if she has any other thoughts on why to do this great state work.
Yeah, and finally, federal work and state work It's meant to be complementary, not in conflict. So in our legal and political systems, state and federal governments have complementary roles and power. There are certain things that states can do that the federal government can't, and vice versa. So in order to make the most stable long-term change, it's important for T1I to be working at both levels.
Thank you so much, guys, for clearly framing why state level organizing is so important for our long-term success. Now we also have Lori Rudder with the US, or with the state working group, and she was part of the first ever US Insulin for All chapter, and I would love for her to share a little bit of that history with us and her own story of advocacy.
The Ohio Insulin for All chapter. I am a nurse practitioner, nurse educator, and I come from a family with a significant history of both type 1 and type 2 diabetes, including my son, who's been living with type 1 since he was 9 years old. Even though I've been in healthcare, I'm embarrassed to say at the time I didn't know, because I've always had good insurance. I was not aware of the expensive cost of not only insulin but other diabetes supplies until I started seeing things in like the online diabetes community about it. So in 2017 September, I joined the protest outside Eli Lilly, hosted by organized by T1 International, and I met a lot of great people there, made a lot of connections, and that led to, in February of 2018, I was invited via Twitter to join a group of tri-state advocates in the Ohio, Indiana, and Kentucky area to get together and discuss local issues and steps to promote insulin pricing transparency. And so the goal of that would be to, organize and collaborate the Insulin for All community to harvest the harm. Hopefully we could create change, hopefully expand to the federal level. So in March of 2018, we met in Cincinnati. It was probably about 10 to 12 of us from Kentucky, Ohio, and Indiana. And we met to organize. And so we discussed our motivation for Insulin for All. We discussed the history of the Insulin for All movement. We were provided some education by the International Advocacy Toolkit. We discussed some legislation that was going on in Nevada, Oregon, and Colorado at the time for insulin pricing transparency. And we brainstormed about, what was our goal. And so we came up with a goal and an action plan. Our goal was to target legislation in our states for insulin pricing transparency, and our action plan was to target the state legislators, and not only that, but the candidates for the 2018 election to obtain some commitment to insulin pricing transparency in the 2019 legislative session. We came up with a name, which was Kentucky. It was KOI, Insulin for All, which stood for Kentucky, Ohio, Indiana. We gave a Twitter handle, an email. We started a communication platform so that we could idea share, and hence the first Insulin for All state chapter was created. It was 3, but we had the first state chapter. And so through that, we shared our ideas, we learned how to advocate, gain momentum, and even some media coverage. In September 2018, we organized the KOI Insulin for All bus that left from Cincinnati to Indianapolis to the Eli Lilly protest for affordable insulin. And since that time, now I see there's like over 40 chapters. And so, to look back from 2018 to now, and when it seemed so daunting change, 41 chapters doing some amazing grassroots advocacy work and working across state lines. And so much has been accomplished in 5 years, and it's just regular people making change. And so now I'm privileged to continue with the state working group, where we continue to learn and motivate and strategize to move forward, so that we don't have to reinvent the wheel. There's so much that we can learn from each other. And momentum is so important in advocacy work, and working across state lines helps with that momentum. We share best practices, we share strategies, tips for making legislation, navigating setbacks, and not only that, but to support and motivate each other in this such important work.
Thank you so much for sharing that, Lori. I have a few questions, and we want to also open it up to the audience. So if folks have questions, please feel free to continue adding them to the chat. I'll kick it off though for Chris and Kaila real quick. What do you guys think about the idea that states can be testing grounds for policies and ideas in a way that the federal government can't? Are there examples of state action helping federal action succeed?
Yes, so states can absolutely become testing grounds for policies in a way that the federal government can't. As Chris said earlier, states are sort of like the breeding ground for democracy. We've seen this happen with copay caps. This movement started at the state level, and now momentum's building at the federal level, particularly with Representative Cori Bush's office and others. And we hope to see similar momentum build for public pharma. CalRx really kicked off something special. More states are becoming more and more interested in the way they can make public pharma happen, and we hope to see this spur the creation of public pharma bills at the federal level in the near future.
I really appreciate that. I know living in Michigan, it's been very interesting to see Michigan take interest in public production and watch it kind of develop. I have another question for Lori. What's one of the biggest challenges or setbacks you've experienced with your advocacy? Can you share the story of what happened next?
Sure, I would say probably life. I was finishing my doctorate degree, and so that with working full time and being a single mom, I think it was just life in general. It just meant I had to step back a little bit. But I teach nursing students, and so every nursing student I teach them not to use the word non-compliant, and that insulin is unaffordable and diabetes supplies is unaffordable. So I'm hoping to create this generation of nurses that won't stigmatize patients with diabetes. And so I continue to work that way. And so even if you have to step back, it takes this whole community. There's still other things that you can do. And then here I am, I finished, and now I'm back in this advocacy work. So I would say just life in general.
Well, I can tell you, as somebody who grew up as a kid with diabetes, I really appreciate that type of thing about teaching nurses about diabetes just in general. So we've had some really great audience questions rolling in. I saw one that I wanted to just kind of give to each of you, which was what gives you hope that we can win insulin for all, and what that kind of means to you?
I can start. I think, like I said, just in 2018, when it seemed so daunting, it was this group of 10 to 12 people trying to figure out how do we get this started, and to see just in 5 years like what's been accomplished. That motivates me definitely.
I'll jump in as someone who's a little bit of a I'm not a person who lives with diabetes myself. I'm someone who has the honor, I guess, of working with many of you who do, and working with this organization. I'll say two things from a sort of American perspective. One just feels to me that our healthcare system is so profoundly unjust and so profoundly broken that it's now personally acknowledged that it desperately needs fixing. Like something has to give, and it feels like there is now momentum that can't be stopped to make some change here. And the second thing is just I see the work that T1 International, the patient advocates do, not just in the US, but around the world. Like all of you are so inspiring and so powerful together. That's really what gives me hope.
And just
I definitely agree.
Sorry. And just echoing everything that's been said, additionally, I feel we're really starting to get people in higher powers in the government that are passionate and really aiming to make healthcare and access to medicines, particularly insulin, more affordable for the average American. So in conjunction with, the passion that advocates inside the T1I organization has, truly that power is unstoppable.
I definitely agree with everything you guys said, and I want to thank you all so much for this conversation. I think it was a great conversation, and I'm really glad we were able to connect today.
Thank you.
Thank you so much, Quinn, Lori, Christopher, and Kaila. What a great discussion. We know that the insulin price crisis is complex. So it was really great to hear about concrete steps our US network of advocates have been taking, and the momentum that you guys have been building for years to truly impact the lives of people with diabetes in real ways. From emergency access to increased accountability and affordability, through public pharma options, the state and federal efforts are working. and there is, of course, still so much to do. If you want to learn more about how you can take action, please download T1 International's policy playbook. And I hope everyone is enjoying the summit so far. I know I am. Please keep on adding to the chat. Let us know what inspired you from our state working group discussion. And we've got another great session lined up for you next. We are really spoiling you guys today.